Next group of medications that are very less commonly used compared to SSRIs and SNRIs are tricyclic antidepressants. These are clomipramine, imipramine, amitriptyline, desipramine, nortriptyline, and some other medications. And you may frequently see them being prescribed by neurologists rather than psychiatrists. So come back to the same picture. We can see that in the red circle rectangle, we can see that TCAs impact the norepinephrine receptors, the serotonin receptors in the middle, and the dopamine receptors on the left, and the histamine related receptors on the um, basically left side of the picture. So they work on multiple receptors, and because of that, they have different side effects and also different clinical impacts, which we'll get to next. So TCAs are also approved, similar to the other two group of medications for major depressive disorder, obsessive compulsive disorder. In addition, they are approved for childhood enuresis, in particular for imipramine. Some of them are approved for insomnia, like doxepin. And doxepin is also being used for pruritus as a topical cream because of the antihistamine.
Could you define what pruritus is?
Right. So pruritus is basically the as a reaction to certain stimuli, your skin gets red, itchy, and it's a basic allergic reaction. So in terms of skin allergic reactions, doxepin topical cream is approved because it's a potent antihistamine, basically. And there are off-label use of these medications in neuropathic pain and fibromyalgia, in migraine, and in irritable bowel syndrome. They're very frequently used, and you may see them being prescribed by neurologists frequently.
Aren't there, I remember learning decades ago that certain TCAs are specific dietary restrictions. For instance, like you can't eat grapefruit or something of that similar nature. Is that right? Is that still hold?
True. I don't have the grapefruit in mind precisely, but there are specific medications that if it's with certain dietary intakes, they may impact the level of that medication in the blood. It's the case for SSRIs as well, the case for the TCAs and for some other medications. But they're usually not the class effect. Not all the medications in that class, but there could be a specific ones that their level might be, their absorption is impacted by grapefruit juice or by orange juice.
Same thing for SSRIs, you said?
Yes, so I know that the food intake can impact, for example, the level of the absorption of fluoxetine or sertraline to some degree. So yeah, they may decrease, like some of them are, it's recommended to be taken with food. So those are the interactions that exist. And I'm happy to get to more details and check that and share that later. But yeah, so here the idea is to mainly stay with the general information in terms of the class of meds. But I'm happy to basically also share more info about the individual medications. And in terms of considerations with TCAs, so they are faster. They act faster than the SSRIs or SNRIs. You may start noticing the impact in a matter of a week or 2 weeks. And they are usually helpful with the same symptom domains plus pain. In terms of side effects, they have considerably more side effects than SSRIs and SNRIs, and that's the main reason many psychiatrists don't feel comfortable prescribing them or try avoiding them. So there is a high risk of toxicity and arrhythmia if overdose happens. There's going to be significant constipation, blood vision, dry mouth, drowsiness, which are mostly related to antihistamine impact. And there could be weight gain, low blood pressure with some of them. Sexual dysfunction is less than SSRIs and SNRIs. So this is a reason to consider them in some cases. But also they need additional workup. We usually need to get an EKG, check vital signs. For some of them, we need to check serum electrolyte levels and also in some cases serum medication level to make sure that they're in the therapeutic range. And for these reasons, they are less favored um, compared to SSRI and SNRIs.